Welcome to the Exercise is Health podcast, where we're talking about exercise, health, and the interconnectedness of the two. We are your hosts, Charlie
and Julie,
and we will be coming to you every single week from our studio, Muscle Activation Schaumburg.
Hey, welcome back, everybody, to the Exercise is Health podcast. We are your hosts, Charlie
and Julie,
and we are coming to you from our studio, Muscle Activation Schaumburg in Schaumburg, Illinois. Now, at Muscle Activation Schaumburg, we believe that your health is your most valuable asset. Your health is one of the biggest influencers of the quality and quantity of time that you have. And while there are many aspects of health, our expertise is exercise. Exercise has been proven time and again to not only improve your health, but also increase your longevity and improve your quality of life. But we know that exercise is not the only piece of the puzzle, and that is why we are bringing you a phenomenal guest today, none other than Dr. Richard Powell. Dr. Richard Powell, DC, has been practicing chiropractic medicine for 34 years and has been practicing functional medicine for more than 10 years. He earned his undergraduate degree at the University of Idaho and continued his education at the National College of Chiropractic, where he earned his doctorate of chiropractic degree. Staying current in the most cutting-edge practices, Dr. Powell has seen the benefits that functional medicine has brought to the many suffering from chronic ailments. That is why over the last 8 years, Dr. Powell has intensely directed his focus towards reversing type 2 diabetes and providing his patients with natural alternatives for managing thyroid disease. Dr. Powell understands the necessity of individualized treatment and tailors his approach to the unique needs of each of his clients. Dr. Powell is the founder of Greater Chicago Functional Health, located in Des Plaines, Illinois, and we are so excited to have him on our podcast today. Dr. Powell, welcome to our show.
Well, thank you very much, Charlie and Julie.
Absolutely. So tell us more. I mean, there's so much to unpack just in your bio alone, from your work as a chiropractor, your work in functional medicine, your work reversing type 2 diabetes and thyroid disease. So where do we start with all that? Where do you want to start with all that?
I would start with my story, how I got into this. As you say, I was a chiropractor for over 30 years and did what I call musculoskeletal type of work with patients and saw a good-sized practice in Elmhurst. And then I found that I had a problem. I had some weight gain. I had some high blood pressure. I found by doing a blood test that my blood sugars were elevated. My thyroid hormone balance was off as well. My cholesterol level was quite high. And I saw my internist, and he was going to give me some standard medications like metformin to lower blood sugar, blood pressure medication, a statin drug to lower my cholesterol levels, and put me on Synthroid for thyroid balance. I looked up all these, and I said, no, wait a second. Let's look at all these side effects. And really the problem is that they don't really address the cause of the problem. So I basically went back to school. I went to Functional Medicine University, 2-year course, and graduated, and then I became my own lab rat. I basically started using functional medicine and found out that my thyroid gland wasn't working properly because I wasn't able to absorb the nutrient iodine. Why was that? Well, because I was eating standard American diet that included bread, which bread has now a starter instead of iodine. It uses another chemical, and it blocks the iodine absorption.
Wow.
So therefore, I became hypothyroid because I couldn't absorb iodine.
Oh my gosh, that's crazy.
And this is happening to more and more people. Now, here's the question, though, is so I took some iodine for a short period of time, because don't let your listeners think that they can just go take iodine and solve their problem. It actually may trigger an autoimmune condition.
Oh, wow.
So it's got to be done carefully and be analyzed properly to see if it's appropriate. But that helped me. And I lost probably 30 pounds within 2 or 3 months.
That's awesome.
Without much more than I was normally doing. I always exercised, did some of those things. But then I found out that my blood sugar was still out of balance. So I found out some triggers on that. I did some further testing. And that's the basis of what I do. It's called functional medicine, where I basically do testing. I do advanced testing. I mean, I do a blood chemistry that's customized for patients that's much more involved than they can normally get.
Mm-hmm.
I do testing for other glands, things like your adrenal glands that sit above your kidneys.
Mm-hmm.
These are glands are your stress glands. And Charlie, these glands are really designed for running away from saber-toothed tigers.
Sure.
But we don't deal with that anymore.
Right.
We deal with traffic, and we do other kind of stresses.
Mm-hmm.
And so this gland puts out several hormones, but the most important one is called cortisol. Cortisol raises your blood sugar, but it shuts down your immune system.
Oh, interesting.
And when it shuts down your immune system, now you're more vulnerable to infections, and that high cortisol will also lead to brain breakdown. So high cortisol is also known to trigger Alzheimer's disease,
Wow.
heart disease, a variety of other conditions. So it's good for running away from saber-toothed tigers, but it really isn't for a good long-term thing. We test for that. Now, your traditional allopathic or medical doctor won't test for it because there's no drug they can give you for it. And in our society, we're in a drug care model. And so we're basically an alternative to that, where basically we can help people find out the causes of their problem.
Very interesting. So when you started diving into all this testing, like when you went to the doctor and you had your initial testing done, did you feel like you were pretty healthy, like you were doing the healthy stuff? I mean, you said you were eating the standard American diet, but did you feel like your stress was well managed? Did you feel like you were exercising, on a fairly consistent basis? Or were you knowingly like not managing your stress, not exercising? And so what was your lifestyle like?
Great question. No, Charlie, I was always been an athlete. In high school and college, I played all sports, and I did very well. And I always maintained, I still love exercise. And so I was always exercising. I did have a pretty good diet. I mean, I didn't eat all junk food, but a lot of it was not what it should be. And I've learned since then what it should be. But how was I handling my stress? Well, I was handling it as best as I could. I didn't really know how to handle it more effectively as I know now. So, I mean, I wasn't having problems with sleep, but I was getting, 6-7 hours a day, not 8 like I get now. And my stress levels were higher than running a practice and seeing patients. There was some of that stress that was going on. But now I'm managing that more effectively.
Well, and see, what's interesting to me about that is, from the outside looking in, somebody would have probably looked and said, hey, you're checking off all the boxes. You're eating pretty well, you're moving regularly, your sleep is not terribly insufficient. It seems like you're getting enough. You're, like you said, you're managing your stress to the best you could. But you still had all these things going on. You still had all these things, and so you still needed to get that testing done to be able to identify that. So that's really interesting to me. It's very intriguing.
What I really like about the story is I can't tell you how many people that come to see us, maybe, late 40s, early 50s, that are starting to have these indicators in their body. They're like, well, I've got a little bit of high blood pressure and maybe my blood sugars are kind of creeping up. My doctor said I need to start exercising, which is why I'm here. And what's really interesting is we don't really think about these things as like that bad. Like, oh, basically everyone gets this. I mean, I'm in my 50s. Isn't that normal? Isn't that kind of regular? And like what Charlie just said, I'm doing all the basic lifestyle things, like kind of active-ish, and I sort of manage my stress and I sleep decent. And it's interesting that you were able to take these things that are quite honestly pretty common. They're just regular things that seem to happen a lot of times. But they're definitely not normal. They're not how your body's supposed to function. So I think that is really interesting that you took it to the next level, saying, hey, well, instead of medications, which is the common response that I take forever and ever and ever, why don't I dig into this and investigate a little bit more? But I'm curious, what made you want to dig in and investigate more? Because really the easier answer would have just been, yeah, doc, I'll take these medications and maybe I'll start exercising a little bit more, or maybe I'll try to lose a little bit more weight and focus on a little bit more. Because you really took the more difficult route of like, okay, let's dive into the books. Let's get way studied up on this because there's got to be something else here. So what drove you to do that?
Great question, Julie. Thank you for asking that. Basically, I looked up the side effects, and I had seen in my practice that I had at the time patients that were on these different drugs and medications. getting no better. In fact, getting worse over time. And so I realized that something's wrong. Something's wrong with that system. So that's why I dove into it. And the more I learned, the more I realized that, hey, you can't cover up a problem. It's like sweeping dirt under the rug. You basically got to get to the root cause of the problem. And once you address the root cause, the body has this wonderful ability to regenerate and heal itself. We're a self-healing mechanism. But there's a lot of medical arrogance that says they're smarter than the body. And that will never work. So I basically had to step back and say, look, let me learn from the biochemical level, from the cellular level, energy. Going back to the Krebs cycle, learning biochemically all the steps and pathways and things that play a role in that. That's what I've done. And awesome. So I can talk to that level if people want to, but I think it's not appropriate here.
Sure,
but,
not yeah.
But right, but I think really the thing we want to think about when we look at healing is energy. And one of the most important things that affects energy is how we can create it. We can create it through metabolism of glucose, which is the most common way. You can also do it through fat and through protein. But glucose is the most common way to do that. And the problem with most diabetics is they can't function properly because they have the most common form of diabetes is called type 2 diabetes, and they have what's called insulin resistance. We know now in the science that there's over 45 different causes or reasons for that.
Wow.
And I've been doing this for over 10 years, and I've seen literally thousands of diabetics. Charlie, I can't say I've seen two people with the exact same causes or triggers. It's always unique. And if the causes and triggers are unique and different, what does the type of care need to be?
Unique and different.
Exactly. Unfortunately, the type of care they're getting right now is it's the same. They get a label on their diagnosis that says you have type 2 diabetes, and they're given 3 types of advice. Change your diet, exercise, and lose weight. They don't tell them what type of diet should be good for them. In fact, you can go to Barnes & Noble and see dozens of books on diabetic diets, but how do you know if it's good for you? And then exercise. Now, we're here to talk about, and you work with exercise, but a lot of these diabetics, they can't make ATP. They can't make energy. And if their energy levels are so low and they can't recover at a cellular level, does it make sense to push them to high levels of exercise? No. And then finally, losing weight. Weight is just basically a side effect of the high triglycerides that eventually convert into weight and fat. And it's a storage for some of the toxins that's in the body. So losing weight doesn't solve the problem either. You've got to get down to the real root cause of the problem.
Very interesting. Very interesting. So is that the predominant focus in your practice now, is moving away from the musculoskeletal work into looking at the biochemistry and the lifestyle design for people, or the lifestyle kind of consultation?
Yes, exactly, Charlie. We basically look at each patient as a unique individual. I do a very, very thorough history, finding out their triggers, their causes, what's gone on in their life. What's causing some of their problems. And we do testing. We do a very blood chemistry. We test adrenals. We do food sensitivity tests. Now we're moved into genetic testing. Wow. We do a variety of different things. So I can test more ways than most medical doctors even know how, and find out what's broken in their system.
Very interesting.
Yes.
Very interesting. So when people come to see you, is predominantly your practice made up of type 2 diabetics because of your experience with that, and is that become like a niche for you, is working with type 2 diabetics?
Yes. And recently I've been doing that for over 10 years. Now we're going into more of the low thyroid, and we're treating that as well. But there's kind of a parallel, because if your thyroid hormones aren't working properly, you can't regulate blood sugar either. So it's kind of like there's a bit of a mesh between the two.
Yeah, very interesting.
So what is it like when people come to see you, Dr. Powell? I mean, if I was a type 2 diabetic listening to this podcast, I'm like, what? I'm going to go to this doctor and I'm going to do 1,000 tests to find out, the cause of my problem. But what is it really like? Like, if I walked into your office wanting to schedule something, or I'm coming in for consultation, what would I expect to be doing or experiencing?
Great question, Julie. First of all, what we have a unique niche, as we say. We find and determine the type of patient that we're looking for, because we can't help everybody. Mm-hmm. Now, it's a big problem. A third of the population is now becoming diabetic.
Wow.
It's a huge
That's
number.
scary.
It's going to get worse, and it's an avalanche that's getting worse with time. But we can't help them all. And not every diabetic is willing to make some of the changes that need to be done. So I basically are screening people to find the quality people that are willing to do the change that needs to be made. Mm-hmm. And I do this through a consultation. I sit down with them. I review their history. And quite honestly, a lot of the history in a lot of these patients is very similar. They're on multiple medications. They're not happy. They've talked to their doctor and said, why do I have this problem? And the doctor, first of all, says, well, your pancreas isn't working properly. It's not the pancreas. They have insulin resistance. I can see that I know in over 10 years there's only been 5 patients that the pancreas wasn't producing enough insulin. Very rarely is the pancreas the problem. So then they ask, well, maybe it's a genetic problem. Type 2 diabetes is not genetic. Now, it's common. You do see it in families, and certain cultures have a higher amount, but they've never found a type 2 diabetic gene. So it's not genetic. So when they talk to their doctor and say, well, what do I do about this problem? And they tell them, change your diet, exercise, and lose weight continually all the rest of their life. And they get frustrated. They've been on multiple exercise protocols, maybe not specific for them, as you folks can provide, but they still are really not getting anywhere. And then they put on one medication after another. They go to blood pressure medications, statin drugs, multiple. The highest I've seen in my office was a 49-year-old man on 19 medications per day.
Wow.
Oh, my goodness.
Yeah.
Oh,
At 49, which is not that old.
I know.
Wow.
Very common.
wow.
So these are the type of things we see. Yeah.
Oh, my gosh. Huh. So you'd come in, you do a consult, and then the testing that you do, is it saliva-based, blood-based? Do you do like urinary analysis?
We do all those. We do. I use a variety of different labs, but one of the right now we use Quest, which is all around the world. Actually, we do that for blood and urinalysis, but we also do adrenal stress test. Now, we used to use a saliva test for that. Now we're using actually a urine test. It's called a Dutch test. It's a dried urine hormone test. It's actually a more effective test, gives us more information for the same cost.
Interesting.
We do a stool analysis. Patients do that, of course, do that at home. There we're looking for bacteria, viruses, funguses, and parasites. We also test for food sensitivities. We use a blood test for that. It's over 180 different foods, gums, spices, proteins, different types of things. And then also we use now 23andMe for genetic testing.
Very cool.
With a different breakdown of protocols for that. So we can find specifically what's causing their problem.
That's really interesting.
Do you have to do all these tests because of, you had just said that most of the time the cause of why this person has type 2 diabetes isn't always the pancreas's problem. Is that why there's all these varieties of tests, because you're trying to figure out which is the one that's leading to the symptom, which is type 2 diabetes? Well,
that's a great question, Julie. It's actually not just one thing.
Okay.
It's always multiples.
Okay.
So the person could have, let's say, an infection that's uncovered. That could cause inflammation, which can lead to diabetes. But when you see an infection, there could be a leaky gut involved with that. There could be an adrenal stress involved with that. There could be a food sensitivity to something it's not most people would respond normally to, like broccoli or maybe halibut or something like that, but their immune system doesn't like it.
Interesting.
So you'd have to customize care and treatment based on everything you see, and then not only test initially, but once they're into care, retest so you confirm that patient's getting better.
Sure.
And then, of course, the results we see, they typically lose weight without exercise. They typically get off most, if not all, their medications. And the complicating factors with diabetes, such as heart disease, kidney failure, blindness, amputations, and the latest is Alzheimer's disease, now known as type 3 diabetes. All those risk factors go down.
Wow. That's awesome. That's just awesome, being able to pinpoint and individualize, customize somebody's care to that degree. That's really cool. Well, I know that we saw a blog post on your website, and we want to talk to you about it because it was a really, really interesting blog post. It said, the most recent one said 5 foundations for reversing diabetes that go beyond diet. You know, what we've been talking about so far today is obviously things more than diet that would implement or that would need to be implemented in order to help somebody kind of reverse their diabetes. And do you find that to be the case, that people's diabetes actually being reversed?
Oh, yes.
Wow. That's amazing.
In our practice, we see over 90% of our patients that we accept reverse diabetes. And we can see it on lab testing.
So type 2 diabetes is, correct me if I'm wrong, it is 100% preventable and 100% reversible. Is it all lifestyle? It's all lifestyle.
Not necessarily.
Okay.
There is lifestyle involved with it, yes. But if they have a hormonal imbalance, that's not going to be changed by lifestyle. They've got to correct those.
Okay.
So you've got to check multiple systems involved. But you got to check all these things. But these 5 foundations, these are things I ask patients on a visit-by-visit basis to see how they're doing. Such as the first one, sleep. You know, I ask them, how well are you sleeping? Do you fall asleep easily? Now, a number of people don't fall asleep very well. It might take them an hour to fall asleep. And so I talk about lifestyle changes with that and how to stay away from blue screens and stop watching TV right before you go to bed and calm down and kind of de-stress a little bit before they start to sleep. Then I ask patients, do you sleep well through the night? You'd be surprised the number of people wake up an hour or two later and they're up for hours because they can't get back to sleep. Again, that cortisol I mentioned earlier, that could be playing a factor. So there's an imbalance of that, and that needs to be addressed. So sleep is one of the biggest components we talk about for patients to allow them to heal properly.
Do you have a way that you recommend people like tracking their sleep or to measure how much deep sleep they're getting or anything like that? I think Fitbit has a way of doing that. I know I use a phone app to do that. Is that something that you recommend that people start employing on their own or that you recommend with your patients?
I haven't. I don't think that's a bad idea. I generally, on a visit-by-visit basis, I ask how well they're functioning, and typically their sleep starts to improve as we start to heal their adrenal glands, and that starts to function better. But I've had some patients that they really have some problems falling asleep. So I told them, hey, go to Google, and you can get binaural beats, deep sleep apps for free, and have them listen to some things to allow them to fall asleep. And they listen to waves and birds chirping and some of those things, and it calms them down and basically helps allow them to fall asleep. So there's some things that tools like this that I think are now becoming available that really help people to do that.
That's awesome. And then in terms of not necessarily diet itself, but like timing of eating relative to sleep, can eating too soon before you go to sleep, is that a consideration?
Exactly, it is. We typically will find, we tell patients to stop eating 3 to 4 hours before you go to bed. However, if they wake up with blood sugar that are higher than when they went to bed, well, they're not sleepwalking and going to their fridge. Their blood sugar should fall while they're sleeping.
Right.
But if that's called the dawn effect, if that happens, where they're basically waking up with a higher blood sugar in the morning, I will have them eat a little bit of protein just before they go to bed to balance their blood sugar while they're sleeping, so it doesn't go too low and then rebound higher.
Very interesting. Yeah. Huh, that's really good to know. So then this second foundation, exercise, that's obviously something that...
Our favorite.
Yeah, our favorite. but we talk quite a bit about that. But talk to us, what do you recommend for your patients from an exercise perspective?
That's what I was prepared to talk quite a bit about today.
I love it, yeah.
First of all, a lot of these diabetics, they can't make ATP at the cellular level. They can't make enough energy. So to put them on a very high intense or big, long drawn out exercise program, most of them just can't really do it very well.
Mm-hmm.
I might have them do deep breathing.
Mm-hmm.
I might have them just do some walking, some simple walking, until we get their blood sugar stable.
Mm-hmm.
And then once we have that, then I start going into some of the more intense exercise. Now, I have basically two types of exercise we talk about. There's mild to moderate, where you're basically just doing some mild walking, maybe on a treadmill, doing some, maybe on a recumbent bike, you may be jumping. And you'll see people at gyms doing that for hours.
Sure.
Now, it's effective in some levels, but it doesn't give you the response that a high intense exercise will.
Mm.
So if you're on a low light to moderate exercise, you don't get any growth hormone release. High intensity, you do.
Mm-hmm.
You don't get the opioid response. That's the runner's high. But you do with high intensity exercise. You don't get the nitric oxide response, which is cleans out the lining of the capillaries, the intestinal of the blood vessels of your heart.
Interesting.
And so you get a little bit of that with light to moderate, but you get a lot with high intensity. Mm-hmm. You get some brain-derived neurotrophic factor. Now, what that means, Charlie, is that allows your brain to rewire and reverse Alzheimer's disease.
Wow.
You get some of that with light to moderate. You get more with high intensity. You get insulin receptor sensitivity. This is the problem with diabetics. If they're walking on a treadmill, they get some, but if they go in high intensity, they get more. They get high intensity is really the most effective for that. And your immune enhancement, your ability to fight off infections. So if somebody has a cold or flu, it's a good idea to do some exercise. You get some of that with light to moderate, high intensity again. So let's define what high intensity is.
Yeah.
High intensity is where your heart is at about, I'm not sure the percentage right now, but normally you take 220 minus your age, and that's your maximum heart rate.
Mm-hmm.
Now, for me, that maximum heart rate's 160 beats a minute. I tell patients, don't try to get there overnight. And it has to be customized, and you have to be in good cardiovascular shape to do that. But I typically have patients I do this myself every day. I warm up, nice mild warm up. Then I go on to an elliptical, which has handles on it that I can measure my pulse rate. I start off, I get up to go 30 seconds as hard and as fast as I can. I'm huffing and puffing. After 30 seconds, I slow down for 30 seconds and I check my pulse rate. It'll go from, let's say, 100 beats a minute to 130. Then I back off for 30 seconds. Then I go hard again as fast as I can. Now it'll go up to 140, 145. Then eventually get up to 160, and when I get there, I'm done.
Wow. So you've trained yourself to be able to tolerate going, but that's one of your goals, to be able to get to that maximum heart rate.
Right. Awesome. And that takes generally about 4 or 5 steps of those periods to get to that level. And once you're done, I mean, you've broken a sweat and you're barely be able to you can't even talk. You're breathing, you're huffing and puffing. But your cardiovascular work's done in 4 to 5 minutes.
Yeah.
Now the rest of the time, the work that you folks do, the specific muscle work, you've got to train muscles, because muscles are more metabolically active than other tissues. So you want to use those to burn calories, to burn fat, to keep other things working properly as well. So now the only downside of this is oxidative stress, because if you maintain that high intense level, it's like camping out at Mount Everest. You don't want to do that. It can cause a problem. So you want to stop. When you get to that high level, you stop and you back off. You don't try to maintain it.
Very interesting.
It is amazing. Obviously, I'm unable to track a lot of the things that you're able to track with your testing and retesting, just because we're not in a medical type facility. But it is amazing how many people I get, and they've been doing the traditional exercise of like, more is better. All the time is better, and if my heart is just racing the entire hour, then I should be getting it done. And it's amazing how many positive changes I see with people in terms of their fatigue changing, how they sleep changing, their weight and body composition changing, and just how they feel throughout the day changes. And they're always blown away. They're like, wait a second, we just cut what I was doing in half, you know, and the intensity is still there, but it might not be as long lived, just like you were saying, you know, you get yours done in 4 or 5 minutes. You know, so it's crazy to see, you know, how much we take away even the stressors that can come from exercise, you know, because I think there's so many people out there that are on the extremes. Like I do 0 exercise. So obviously we have to teach you how to be able to tolerate exercise and gradually get you into it. Or I do way too much exercise, and that's also why I'm not seeing, you know, I'm not feeling healthier from it. I'm not, you know, feeling more energized from exercise, which that's what it's known to do. But I think sometimes it can be just the fact that, yeah, I'm hanging out on Mount Everest every day for an hour because I think that's what I'm supposed to do. So it's pretty cool that you've also experienced that with your patients as well.
Right. And the other component of that, Julie, is that if they try to maintain a long-term, like go on a treadmill, you see people at the gyms, they're on a treadmill for like an hour. Mm-hmm. They're wasting their time a lot of the time. And they're also training their heart at a certain capacity. Mm-hmm. And they're not able to handle the additional stress that cortisol will put out. This is why you see some of these marathon runners that have been running, you know, they run 24 miles in a marathon. They go out there and they have some kind of an emergency event on a Monday morning and they die of a heart attack because their heart's not able to handle that additional cortisol.
Interesting.
Because it's so stressed.
Because they maintain a certain level, but they can't handle the little changes. So you want to think of exercise kind of like aerobic exercise, particularly, kind of like how you played as a child. You ran down the block and you huffed and puffed. You sat there, okay, but you didn't go run around the block 5 times. Mm-hmm. Yeah. You know, you didn't do that. And so we need to be thinking along those lines. And we're busy people, so we need to basically consolidate that aerobic into a short, intense amount of time, and then certainly spend time doing muscle work and balancing properly and do the things that you folks could do so you don't hurt yourselves and keep stable. Yeah.
Very cool.
You mentioned, you know, the 2 categories, and I like that you divided those out because there really is, you know, true benefit from both, the lower and then the higher intensity. So with the diabetic, when is it appropriate to move from doing the low intensity and then going into high intensity? Are there markers that you look for that says, okay, now your body could be prepared to experience some of the higher intensity? Great
question, Julie. I basically take all my diabetics and I say, hey, look, I find out when I do a physical, when I analyze them initially, a lot of them have high blood pressure. They're on multiple medications. A lot of them are quite obese. Mechanically, they just can't do much exercise. Mm-hmm. And so we need to get their system reset. And now, you know, my patients lose, 20, 30 pounds in 6 months. And once they start losing some of that weight and they're starting to becoming more active, they're starting to sleep more effectively, I move them into that, and I'm asking them how those things are working on a visit-by-visit basis. Then I customize care. I say, okay, now we want you to, your goals now would be to walk to the end of the block. Next couple of weeks, now you're walking around the block. Mm-hmm. And next thing you know, okay, now we're gonna add a couple things. Instead of, a lot of people are sedentary, I say every hour I want you to stand up and I want you to do 10 real deep breaths. Mm-hmm. Do some of this type of activity on a regular basis. Next thing you know, they're able to take on a little bit more. And when they start taking on a little bit more, they become excited.
Yeah. No, it's really neat that when you don't have to go jumping into the deep end right away. You can just kind of, as you're talking about, just little by little, adding just a little bit more challenge, a little bit more stress, and then you get these compounding results. And then after a few weeks or a few months, it's like you can do way more than you could before. I think that's one of the things that Julie and I run into all the time just in exercise is people think they have to go from 0 to 100% all in, overnight, and that's not the case. It's like you just got to get moving. Just do a little bit, like you're saying, walk to the end of the block, do that a few times, and then we'll get you walking around the block. And 3 months from now, 6 months from now, you'll be doing a lot more than you were today. But the name of the game is to be able to do that sustainably and to be able to do that for years to come. So I can really appreciate where you're coming from with that perspective.
Well said. Exactly.
So foundation number 3 you have in this blog post is the microbiome, which on this podcast we've talked about very, very, very little. We've had one guest that spoke of the importance of gut health, but tell our listeners more about the microbiome if they're unfamiliar with it and how it relates, the health of it could relate to reversing type 2 diabetes.
Well, the microbiome is a relatively new term. I'd say in the last 5 to 7 years, it's become the norm. We've talked about this. Basically, it's a collection of bacteria that live in your intestinal tract. And there's good and bad bacteria. The majority of them, the good ones, they create B vitamins, help us absorb minerals. But they found that this microbiome actually helps create 90% of your serotonin and dopamine. These are neurotransmitters in your brain. That's why we call the gut the second brain. Mm-hmm. And there's a connection between your brain and the intestinal tract. It's called the vagus nerve. And so the healthier the intestinal tract is, the bacterial in there, the healthier you are. And so a lot of people we find that have their intestinal tracts not working properly, their diabetes isn't working properly. We test this through a stool test, and we find very commonly they may have parasites, may have bacterial infections, they may have viruses and funguses. So we have to look at addressing this problem. This is a core problem you'll find with multiple systems is the intestine, and so if we address that issue properly, and then you'll be able to rebound. They've actually doing some testing where they're basically changing the microbiome, and they found people's health will improve significantly. They've done this with autism. They've had numerous things that they've found that they can change the system. Multiple diseases will be resolved.
Very neat. Very neat. And are you changing it mostly through dietary changes?
A lot of it dietary changes.
Very cool.
We have to basically remove the problem that's first. It's several different R's here. Remove any offending problem. If they have an infection or a food problem that's going on, we have to get rid of that. We have to replace it. Put some good probiotics in. Put the good bacteria in. Put good food in that will allow the body's intestinal that bacteria to grow in a proper colony. Yeah, you have to do those things. And you basically help the body stay healthy by feeding the good bacteria in our intestinal tract.
Very cool.
I do have to agree with you that microbiome is definitely a new term that we've been hearing infrequently still. But what are some signs or symptoms that people have that really lead you to think, microbiome, that people might notice on themselves?
Okay, a lot of things is you have several different excretory organs. One is the colon, of course, and the urinary system, but we have the skin. So a lot of people that have skin problems might have a microbiome problem.
Interesting.
A lot of their energy levels could be low because they can't absorb their nutrients properly. You can't absorb your glucose or your minerals properly because the microbiome's imbalanced. You can't absorb your vitamin C and your D and your iron and your B12 and some of these nutrients. You can't make energy. So if your energy is low, if you're not sleeping well, and if your brain's not working properly, if you have a cranky attitude all the time, you might want to look at the microbiome.
Sure.
Charlie, you got to look into that.
Yeah.
That's wonderful. Thank you for that info. Now, foundation number 4 was oral hygiene. Now, this is very interesting because we're talking about type 2 diabetes. How would oral hygiene or addressing oral hygiene help to reverse that? Well,
oral hygiene, remember, not only we have a microbiome in our intestinal tract, we have one in our mouth as well. There's bacteria in our mouth, and if these bacteria are not kept in correct balance, They've found that oral bacteria can actually lead to cardiac and heart disease. And so I help tell patients, I say, brush your teeth every day, multiple times, floss your teeth, get a hydro floss or a water pick, use some of those and keep the gum line clean. See the dentist, keep that oral health bacterial balance proper in the mouth. And if you've got an infection, that's going to lead to increased cytokines, increased inflammation. That's going to affect your diabetes. Had one patient that she was diabetic, and she had a chronic long-term infection at her tooth. And a lot of times people will get a root canal, but they can have a low-grade infection at the bottom of the root canal, and that can cause a problem. Of course, we know a lot of people may be aware of amalgams, which is where they're basically putting mercury into a filling, the silver fillings. That can lead to an inflammatory process. Mercury is a very toxic heavy metal in the body. So that's an important one. The dental associations now, they're not really changing their stance on that because there's a lot of financial gain on that. But the new science is really looking at as mercury is a big toxic event.
Very interesting. And I also saw, I think, maybe one of the, so it says right near the end of that foundational tip, it says using charcoal or probiotic-based toothpaste as a healthy alternative. I've never heard of charcoal or probiotic-based toothpaste. Where could somebody find that?
I have seen it. If you are ever on Instagram, you see this people brushing with black stuff, right?
Wow.
Is that right?
I've not seen it, Julie. I'm not surprised, but if there's a toxic event going on, they can take activated charcoal. I've taken it in capsules and swallowed it, and that will help in the gut. But as far as a charcoal, that's going to be like the Oreo cookie. Kind of unusual on that one. But I think I basically use a holistic type of toothpaste that doesn't have fluoride in it. Fluoride basically helps kill bacteria, the beneficial bacteria. It really doesn't really harden enamel except when you're a young infant.
Oh, interesting.
And so there will fluoridation of water systems. It's not a good. I'm not a big fan of it. I basically filter that out of my water.
Gotcha. Now, foundation number 5 was stress management. So, what are some stress management techniques or practices that you promote to your patients?
Well, we do the testing for the adrenal glands, and that's where we typically will find an imbalance there. So we might use a particular nutrient or supplement that helps with the adrenal function of that. But we need to basically address the what's going on with the stress. So we might have them do some mindfulness, some meditation, maybe yoga, those things, deep breathing. There's now apps you can basically listen to and basically help reduce your stress levels. And those are very helpful and beneficial things to help do that.
That's awesome. And do you see that when people are meditating regularly, practicing mindfulness, that the adrenal stress changes?
Yes, we have, and with our testing, we can typically see that adrenal function improve. Of course, that's reducing cortisol levels. Their sleep gets better. Their stress levels get better. They feel better, and their blood sugars come in more into balance.
Very neat. Very neat. From a meditation standpoint, is there a minimum that you recommend to your patients, or do you guide them in that regard at all?
I'm relatively new to that, Charlie.
Okay.
So what I've done is I use an app myself. It's a free app, and I basically do it. You can go 5 minutes, 10 minutes. I do 30 minutes.
Awesome.
And I basically listen to that, and it helps me calm and de-stress.
Very cool.
So and I've turned that on to some number of my patients.
I love it.
Yeah.
Sure.
I love it.
I love that. I feel like now meditation is slowly becoming like less of a weird practice and more acceptable. But what I really think is cool is that a lot of the pushback, well, this part I don't think is cool. A lot of the pushback I get from my clients is that they feel like it's not really going to do anything for them. Like, well, I'm just going to sit there and breathe. What do you mean? But it's really cool that you are able to measure those changes of stress load on the adrenals and see the actual changes that it brings. Because I think when we just meditate every day, we might feel like, well, maybe I feel a little better after that. But the fact that it actually has, a health promoting result is really cool.
Yes. And a lot of people have the fallacy of thinking that, well, I've got to meditate. It means I got to shut off all the little monkey mind in my brain. That's not going to happen. And so just realizing that it's like, look, just kind of be calm and just be accepting of what that is. And going back to the breathing, just keeping thought about your breathing and putting yourself in the present moment. This is where most of our problems reside, when we worry about the past or we're worrying about the future. Mm-hmm. Worry is one of the biggest stresses we have in our lives. And if we can basically go into the present moment and be conscious and aware of where we're at right now, you can't worry. Mm-hmm. And when you're in that moment, the stress levels reduce.
That's awesome. That's really cool. Well, thank you so much for going through these with us. I mean, I think there's so much valuable information just in that one post alone. So yeah, thank you for creating that post, for putting it out, and thank you for walking us through each of those foundational steps.
Yeah, and we will link the post in the show notes. So if you want to review what Dr. Powell has just reviewed and we've discussed, please feel free to check it out in the show notes, and we will put the link there.
Now, Dr. Powell, what are some things that you do on a regular basis to maintain your own health? We talked about the 30 minutes of meditation. We talked about the high intensity cardio activity. What other practices do you employ?
Well, I typically work on several things every day. Mm-hmm. I get up in the morning. I drink 3 or 4 glasses of water, tall glass of water every day, because we're dehydrated when we wake up. Mm-hmm. And a lot of people just aren't drinking enough water. Mm-hmm. But I have good, clean water. I have a filtration system where I basically am drinking good quality water. I take a number of different supplements every day to keep myself healthy. I make a good smoothie every morning in my blender.
Awesome.
Sometimes I'll add spinach, sometimes kale to that, but I'll have that. There's times right now where I'll go through where I basically won't eat for like 6 hours perhaps. Mm-hmm. I'm doing intermittent fasting.
Awesome.
And then I eat quality food. I typically try to eat organic. Mm-hmm. I did a test on myself and found out that I have Roundup in my system, which is a herbicide they're spraying on most of our foods. This is part of an organic acid test that we're available to test for. So wow. I was surprised to see that, and now I'm taking some, and now I'm also doing, at the health club, I'm going into a sauna to sweat out some of those toxins.
Awesome.
Okay. I do some type of form of exercise every day. Mm-hmm. This morning I get up and I did my age-in push-ups. I'm 66. Okay. Nice. I'm doing squats, doing the same thing, and so that was part of my morning workout today. I also will do some meditation. I put some headphones on and I listen to some binaural beats, and I'll do some of those things every day.
Very cool.
Always reading something, some new activity, new books on those sort of things. And then I do lab work on myself probably every 3 months, so I can see and verify my values and see what my lab tests are showing as well. And then I have fun. I try to make myself laugh and try to have fun.
Very cool. I love that. I love that you're practicing what you're preaching, and it is showing, because you don't look 66 at all. So it's doing its work. So good job. Yeah, well done with that. So what would you say are some things that our listeners could do, if there are maybe like 3 things that they could do to start implementing today? We covered a lot. What would you say maybe are top 3 things that that they could implement today to either start improving their overall health, or if they think they might be trending towards type 2 diabetic status, maybe start to reverse that a little bit?
Okay. Let's kind of reverse what we talked about, stress. Mm-hmm. Okay. One of the recent things I've learned, yawning. Yawning helps put you into a parasympathetic mode, which is where you feed and you heal. That calms you down. Now, you don't have to be tired in the middle of the night. You just kind of yawn. They've actually found that they can help people with Parkinson's disease, but if they have them yawn for 5 minutes, their tremors reduce.
Wow.
So yawning is a simple thing they can do on their own
Wow.
to reduce stress.
That's cool.
I've never heard that
That's
one.
really cool.
So when I'm yawning, no one take offense. I'm just practicing getting in my parasympathetic mode.
Drinking more water, quality water. Get a filtration system. Drink more water. That's a simple thing they can do as well.
Love it.
And of course, breathe.
Mm-hmm.
That's a very important thing. But in really take care of your health. Really put your health as a top priority in your life. Because if you don't have your health, what have you got?
Mm-hmm.
And a lot of people get busy in their lives thinking about other things that are more important. Mm-hmm. They're worrying about their job. They're worrying about their kids. They're worrying about all finances, whatever it is. But unless they put their health as their top priority, they really won't make the change that need to be done.
Mm-hmm. That's awesome. That's good stuff right there. So where can our listeners get a hold of you? Maybe they're in the Chicago area and they're thinking, hey, you know what? I would love to get some of these tests done. I'd like to see if I'm a good candidate to be a patient for you. Where can they find out more about you and connect with you?
Well, we have a website, and it's called Greater Chicago Functional Health.com, and we can also reach us at our phone number. Christine is the office manager. She handles my phone and my schedule, and that number is 630-832-4077.
Awesome. And we'll put all of that in the show notes so our listeners can look that up. And you have an event coming up, correct?
Yes.
On August 28th?
Yes.
A dinner? Can you tell us about that?
Yes. This is where we're going to have a diabetic dinner. We're going to be talking about some of the latest techniques and ways to help get rid of type 2 diabetes and how we approach doing that. It's a free dinner. I basically invite the people to come to that. There's a couple qualifications. They have to be a type 2 diabetic, and they have to have their health be willing to make some changes. They have to be motivated to do that. And so we have some qualifications. If they call that phone number, Christina can see if they qualify to come to that event.
Okay, awesome.
And that will be around the Rosemont, Des Plaines area. And it's entertaining. I teach a lot of new information, some latest techniques, latest things that's going on, things they can do on their own, and what it would take to become a patient of mine.
Very cool. So for our listeners, if you're interested, give Christina a call. Tell them the number one more time.
630-832-4077.
Call that number. It's Tuesday, August 28th is going to be the dinner. So if you're interested, give them a shout, see if you qualify, and you're going to get, if you thought there was good information here, I'm sure they have phenomenal information coming at you that night. So definitely sign up for that.
Plus, you'll probably get to have a delicious but healthy meal, I'm sure.
That's true, Julie. Thank you.
Now, the final question that we like to ask all of our guests is, Dr. Powell, what is your definition of health?
Good question. Basically, health is the ability for the body to heal itself. Getting to the root cause of the problems that we allow to happen to our bodies, basically removing those causes, the body has a self-healing mechanism. We have this innate intelligence that allows our body to actually recreate itself on a cellular level every moment. Mm-hmm. You get new lining of your intestinal tract every 4 to 5 minutes. You get new bones once a year. You get new skin every 3 months. Muscles every 5 to 6 months on a cellular individual level. But that's all created by the natural intelligence your body has. That comes from within and grows out. You can't heal your body from the outside in. It's got to be from the inside out.
That's awesome. Very cool. Very cool stuff. Well, Dr. Powell, thank you so much for joining us. We really appreciate you giving us your time and for walking us through all this amazing information. So thank you very much.
My pleasure, Charlie and Julie.
Awesome.
Thank you.
Absolutely. And for our listeners, thank you so much for tuning in. If you enjoyed this, head on over to iTunes, give us a 5-star rating review, and click subscribe, because next week we are answering your questions. So if you have questions, send them in, info@matschaumburg.com, and we will be sure to answer them either next week or in our September Q&A as well. If you enjoyed today's episode, share it with somebody that you think might get benefit from this. Have a fantastic week, and we'll talk with y'all next week.